Greetings. Good morning. It's truly a great honor for me to be with you. Uh, Please forgive me for not being there in person due to some prior commitments that I could not get out. My role is to share with you about how to become a competent endoscopy technician and what all resources you have and how do you advance in your field as well as assist your endoscopists. I would like to first congratulate the Society for Gastrointestinal Endoscopy of India and the American Society for GI Endoscopy for partnering in this great educational program dedicated for endoscopy technicians. I was told this is first in India, and I'm also delighted to share with you another great news. Dr. Pratik Sharma, one of our own, will be starting as the president of the American Society for GI Endoscopy later this year. He is the first one to achieve that special honor to lead a major international endoscopy society. Please take time to congratulate my good friend on this great achievement. Special thanks to Dr. Pramod Garg and to Dr. Rajesh Puri, as well as to my good friend Dr. Nalini Gouda for putting in a lot of hours and a lot of hard work to organize this great event. I also want to thank and express my gratitude to my senior mentors as well as senior colleagues who have taught me a lot during my training in Chandigarh as well as in New Delhi. This is where I work, the University of Texas MD Anderson Cancer Center in Houston, and I bring you good wishes from this great institution. I also want to make a pitch to you, that is how important an endoscopy technician is. So let me take you back to 1986 when Dr. Jung Dilavari taught me the ABCDs of endoscopy. You all know Dr. Dilavari was the first in India who has done endoscopic sphincterotomy and removed bile duct stones. And when I reached out to him to learn the art of endoscopy, he did not give me the scope. He asked me to see Mr. Hakikat Singh, his chief endoscopy technician, and he told me that I should wash at least 10 scopes and watch and learn from Mr. Hakikat Singh. After Mr. Singh taught me how to clean scopes, made me clean scopes, and then gave the green signal that I did a good job, then only I started my career as an endoscopist. The reason why I want to tell you this story and I want to express my gratitude to these two gentlemen, my mentor Jung Dilavari and Mr. Hakikat Singh, is we in endoscopy work as a team. It's important to know what each one is doing, especially for the endoscopists. And endoscopy technicians play an important role that allows endoscopists do great work. And I wanted to share with you how much I admire my endoscopy technicians. And I want to congratulate all of you for taking this course. And I want to share another important message, that is, I can assure you that you will have a great opportunity to grow in this field. Endoscopy is growing crazy. What I mean by that is, if you go back prior to 1970, about the time when I was just in high school, all gastrointestinal diseases required surgery. And in the last 50 years, endoscopy has steadily replaced surgery to treat various gastrointestinal diseases, whether it is controlling bleeding, removing polyps, removing stones, treating obesity, or treating various motility disorders. You will also be surprised to know how many procedures are done in the United States. At least I know the numbers there. I'm sure a lot are done in India. In the United States, each year, 22 million endoscopies are performed. Why is this number important? Because every endoscopy procedure is done by the endoscopist with the help of an endoscopy technician. So without the technician, these procedures will not happen. So keep that thing in mind. And that's why I'm saying and congratulating you for taking up endoscopy as a way to grow in healthcare. Because of various advances in technology and development of techniques, endoscopy service has certainly exploded, but it requires a team with great talent to continue into the future, and I see some cracks. Although we have formal training programs to train physicians into endoscopists, we do not have programs to train endoscopy technicians or endoscopy nurses, and in most centers, they come to the job and learn on the job. I was just listening to Dr. Nirmala Sitharaman's talk, and she came up with a beautiful message. That is, one should be trained and ready to work. And that's what we're going to do. In order to get there, let us look at the role of a technician in the endoscopy unit. So as you can see here, at the top you have a patient coming into the endoscopy unit, gets prepared, goes through the procedure, and then goes home. When you look at that, endoscopy technician plays a significant role, starting with disinfecting the scopes, setting up the room for the procedure, setting up the electrosurgery, assisting in various diagnostic and therapeutic procedures that the endoscopist performs. You can see there is a lot of blue there that indicates the breadth of endoscopy technician, the breadth of various roles that the endoscopy technician plays. Unfortunately, we do not have a formal endoscopy technician training program in the United States until recently, and that is a problem. We actually looked at the data in Houston area. Majority of the technicians have had no formal training, and that is even worse for nurses. And when it comes to certification, we don't even reach 50%. Small numbers. And we felt that we should come up with a formal training program so that patients get the benefit of having an excellent team to have good outcomes. So we reached out to the Houston Community College, that is inside the Texas Medical Center, which is a huge complex of several hospitals, and started our journey way back in 2015 with the idea to develop the endoscopy tech training program, first of its kind. Because there was nothing to start with, we actually have to come up with a program called DACUM. What is DACUM? DACUM stands for Development of a Curriculum, that is usually undertaken when somebody says, hey, I want to start a new program, and there's nothing to fall back onto. So we start with a DACUM. The community college dean for course development and another senior professor came together, invited 10 experienced endoscopy technicians from various centers in the medical center. They spent about 16 hours and they asked them, what do you do from the time you come to work until you go home? What are all the things you do? And they started noting down various things they do. They divided them into what knowledge is required, what skills need to be developed. And that led us to create a plan, the basic knowledge and skills required to assist upper GI endoscopy or EGD, colonoscopy, and enteroscopy. As you can see here, looking at the journey of an endoscope starts in the disinfection room, then procedure setup, assisting the procedure, and then room turnover, and then other soft skills that are required. As you can see here, there are so many different skills and knowledge areas that need to be developed for a good endoscopy technician. And when it comes to advanced endoscopy like ERCP, EUS, bariatric endoscopy, third space endoscopy, or deep enteroscopy, the skills get much more complex, and the knowledge that needs to be gained is also quite extensive. So we created a game plan for what needs to be done, and then we wanted to create the learning material in-house. Unfortunately, community colleges do not have experience in endoscopy, and there was no other program that we could lean on to start the program. So we decided to develop the endoscopy learning material on our own. I had the distinct honor to work with two amazing personalities, Ms. Sanji Suresh, an educator with Masters in Education, and Ms. Angela Deal, a medical illustrator who was on faculty at the UT Southwestern Medical School in Dallas. Working with them with philanthropic funding support from John Stoline Endowment, Mr. Charles Butt and Hitchie Grant, and the Bootwalk Grant, we started creating the learning material. This required a lot of resources. Almost 2 crore rupees equivalent in dollars was spent over 3 years to create richly illustrated slides, close to 2,300 slides, and those slides were converted into 175 audio recorded videos to help with self-paced learning. There are some key educational learning concepts included in this creation of this learning material. So every lesson plan has not only the lesson, learning material, but as the lesson goes, we have incorporated check for understanding that included quizzes, stop and jot sections to assess critical thinking, and case studies where one could synthesize their understanding and come up with a plan. So to give you an example, this is lesson plan 27 for band ligator. We felt that knowledge that needs to be covered, and by the end of the session, what should the student learn? So let me take you through this in a very fast manner. Most of you may be aware of this material. So when it comes to band ligator, somebody needs to know that it controls bleeding and also helpful in resecting tissue. That is again shown in a beautiful illustration. We also felt that the student should learn some anatomy of normal portal venous flow and what happens in cirrhosis with the development of portal hypertension, and how do the varices develop, progress, and are likely to bleed when they come to a particular size or develop certain signs, and how does band ligation helps. We also make sure that the student learns the importance of appreciating where the perforator veins are maximum, and then we include a quiz to help them learn where one should start the banding based on the number of perforator veins and their location. So this is how we actually made the learning a little more fun and interactive among the students. And then when it comes to the technical part, we use the back table concept where we try to open up the devices, put it on there, and then explain the different parts like a surgeon does for the surgical assessment exam for MBBS students. And then how do you set up the device, difference between a two-way position and firing position, and then step by step assembling the band ligator, and finally making sure that you set up the band ligator so that you have a beautiful view by avoiding the cards from interfering the view. And finally, when you give the endoscope loaded with a band ligator, how do you even set up the knob, whether it's in the two-way mode or a firing mode? And that's also very important to keep our patients safe. And then they learn about what the endoscopist does, where does he puts the bands, and it's important to learn because some devices are made with latex, and they should appreciate the importance of asking latex allergy, and then complications once you put the band ligation. We felt that the technician should learn all this material. And finally, we end the session with a check for understanding, trying to make sure that they've learned. If not, they go back and read. Because this is richly illustrated, students will learn much faster, and we end up with a case to let them learn about the pathology aspect as well. And we included some references. In addition to this, this whole learning material that you've seen so far has been converted into a video, audio narrated video that I've done, keeping in mind what an experienced endoscopist would want from an experienced technician. So I've put in thoughts that an endoscopist would like to see the technician do, an experienced technician does. And this is this covers 175 videos, cover the entire course material relevant to endoscopy. And this is available to the community college students. This is also available at the ASGA Learning Library. And I also decided that I should put it out on the YouTube so that anybody from anywhere in the world who is interested in learning can learn from the YouTube free of cost. And I must say here, this YouTube site is not monetized. Let me take a detour to share with you what the American Society for GI Endoscopy is doing, several initiatives that the governing board has taken. And you all know that the American Society for GI Endoscopy is the oldest endoscopy society in the world, uh, 80 years old. And in the last few years, the society has put in a lot of resources to develop the endoscopy tech training program and certification. And they have included all the curriculum here. Whatever we talked and whatever material that we developed is all included here. And we also taken another step, that is create a question bank that's been reviewed by experts, and we have done 3 pilot tests to figure out where we should set up the pass mark, and we decided that 75%, which is a high bar, but I think you don't want to go to anybody who is not performing at a high level. And that's the test you're going to take. And this is a certificate of completion that the ASG has prepared. I'm delighted to share with you several of my endoscopy technicians from the University of Texas MD Anderson Cancer Center have achieved more than 75% mark, and they were given the certificate. I was told Mayo Clinic Rochester endoscopy technicians also received a similar certificate, and all the students who graduated from the Houston Community College also passed the test. So coming back to the community college felt that all their students should be tested by an external body in addition to their in-house test, and all the students from the first batch in 2022, second batch in 2023 passed the test successfully. I must add here that some of them had to retake the test because they missed by several points, and eventually they passed. Dr. Rajesh Puri has asked me to share some thoughts on how to be an exceptionally good technician. And we all have seen and have gone through some pains recently when India lost in the finals in the cricket match. It all boils down to whether you do a good job, when the patient does a good job, does well or not. Like any other team based event, endoscopy is a team sport, and everyone has to play well to come out well. So, when it comes to endoscopy, I would like to share what I've learned from Dr. Jung Dilavery and my other mentors, Dr. S.L. Brewer and late Dr. Anand, that one should be prepared for the procedure, plan and make sure all the accessories are available, and be actively engaged so that you are not only anticipating what the endoscopist will need, but you should also assist the endoscopist to make sure the procedure goes well by being in sync, and with a little communication, things should flow smoothly like silk. I want to thank both societies, the ASG and SGI, for investing a lot of resources in endoscopy technician training, and this will help my colleagues and endoscopists around the world to grow their practices and take care of more patients safely and effectively. And finally, I wish you the very best with your careers, and with your certification exam. I also want to share with you something that is important. We put in the effort, we take the exam, and if you pass, congratulations. If you don't make it, don't be disheartened. It's an opportunity to learn and redo and pass the test. Nobody knows how many times somebody failed as long as they passed ultimately. I failed my membership exam in England twice, and the third time I passed. And I have my whatever 4 letters after my name, but nobody is looking at how many times I failed. All they know is I passed. So just keep that thing in mind. Being from India, I want to say one thing that comes from Gita, that is, our job is to do the job and leave the result in God's hands. And finally, best of luck to all of you, and special thanks to organizers of this great educational event, and special thanks to Dr. Garg, special thanks to Dr. Rajesh Puri, and again, thank you, Nalini, for all your support, and thanks to all my friends and mentors. Uh, Please forgive me for not being there, and I hope this event is useful for you. Thank you.